Hello, my name is Candace Cordes. I currently work as a dietary aid worker at a nursing home and rehabilitation center. When I first started working there 2 years ago, I had no idea what most of these restrictions meant or that they even existed. I also didn't realize the importance of each of them. All the time we have family members that come in and want to feed their relatives certain foods. The problem is that the relative may have dietary restrictions and they can't have that certain food. In order to prevent this, I'm going to tell you about some of the dietary restrictions in the nursing home that I have to deal with every day. First off, you may ask why dietary restrictions exist. The main reason why some patients are on a restricted diet is due to aspiration. Aspiration is when an object like food or a liquid is blocking your airway. This is a result of dysphagia, or difficulty in swallowing. Aspiration can lead to many health problems, including pneumonia. These problems are more common in the elderly, like in the nursing home that I work at. Now I'm going to tell you about some of the most common dietary restrictions I deal with in the nursing home, so maybe you can help prevent these problems in the future. I'm first going to start off with different diet textures. Mechanical soft foods are foods that require less chewing than your regular diet. For example, during supper we are having a chicken breast, mixed vegetables, and mashed potatoes with a dinner roll. A person with a mechanical soft diet will need the chicken breast chopped or grounded to be able to eat it, and then the mixed vegetables, mashed potatoes, and dinner roll are soft enough for them to swallow so they can have it like this. A puree diet is foods that you don't need to chew. Their food has to be blended up to make them softer. These foods are like the texture of applesauce or mashed potatoes, as shown in the picture. Two types of liquid diets are clear liquids and full liquids. People on clear liquid diet are usually sick or just had surgery, so they drink liquids like apple juice, ginger ale, water, and they can also have chicken broth and gelatin. A full liquid diet consists of just liquids, including soup and ice cream. Now I'm going to talk about some of the different diet types. A house diabetic or a low concentrated sweets diet is the most common diet I see in the nursing home and is typically for diabetic patients. This diet is to help control patients' blood sugar levels. These people need to avoid sweets like cakes, ice cream, honey, and sweet tea unless there are no sugar added. A renal diet is for people who have problems with their kidneys, such as acute or chronic renal failure. These foods have to be low in protein, phosphorus, and sodium. They especially need to avoid processed foods and limit their intake in citrus, fish, potatoes, and dairy products. A heart healthy or no added salt diet limits a patient's intake of salt in their foods. These patients usually have problems with their heart, such as heart disease or heart failure. Sometimes patients also need to be put on thickened liquid diet if they have problems swallowing their drinks. Nectar thickened drinks can be easily poured and is mildly thick. Drinks like milk, water, tea, and juices all have to be thickened. Honey thickened drinks are thicker than nectar thickened and as thick like honey as shown in this picture. Now, next time you visit someone in the nursing home, I hope you remember these diets and be more careful if you give them food. Thank you for your time.